Hi class. I wanted to give you some more in-depth information on your term paper for this semester. And this term paper, I actually call it the celebrity paper, but it doesn't necessarily need to be a celebrity that you have in mind, such as somebody who is like a movie star or anything like that. You definitely can. The sample paper I have for you is done on Robert Downey Jr., and he definitely is somebody who is a movie star who fits that celebrity mold. But I actually mean for you to choose somebody who you can easily get information on in the media without having to do any really tough digging. So by this, I've had students who've done papers on, what's a really popular topic? Serial killers, especially for this class. And I've seen almost all of them. I've had papers and projects done on Ted Bundy, on Dahmer, on what was it, like the refrigerator killer, uh, all any person that you can think of that has Norman Bates, that had some kind of famous book or movie made on them. I have already seen it. However, your classmates may not have, and you may not have either. So if someone catches your eye and you are interested in doing research on them, feel free to do that. Now, in your paper, you will be calling them your client, and we technically, in order to do a full term clinical diagnosis, this actually isn't allowed. So the only person who will be reading this paper is going to be me. No one else will be reading this paper, so I'm basing it off of specific criteria that I'm looking for. So as you're going through, I had already put up a sample paper of a student sample paper who had done Robert Downey Jr. So he is off the table. You cannot do your project on him anymore. But it was also done in APA 6th edition format. Last semester, because we were transitioning, I let not just remote, but we were transitioning from the 6th to the 7th edition APA format. I'm no longer accepting 6th edition, so make sure you are basing your paper off of APA 7th edition format. And I'll go over some of that information later on in this updated term paper that I have for you. So the length overall of content should be about 5 pages. Now, content, this means all the information that you need to include in terms of the research you've done, in terms of the analysis that you've done, but not including your title page and your reference page. This likely isn't your first psychology paper, as you have had Introduction to Psychology or Principles of Psychology. So I do expect you to be able to format in APA. I'll also link some additional information for you to get help with resources on finding that. Also utilize the Writing Center here, because you, as a student here, you have access to that help and that tutoring. And in graduate school, it is no longer free. It's anywhere from $30 to $80 for an hour to have somebody read and edit your paper. So do take advantage of that. Sign up for those services. They do digital tutoring. So I highly recommend that you utilize that resource. Okay, so after you've chosen your celebrity, or anybody that you are easily able to find information on, go ahead and make sure that they actually have things that can be symptoms that can be diagnosable. I've had people do their projects on celebrities that have minor things going on, and we all do. We've all got something going on, whether it's an adjustment disorder. Everybody's going through an adjustment right now, but you do want to have enough information to thoroughly do this project. So by that, I mean find information where the person has clear symptoms, whether it's from an interview or from the news or from whatever you're actually seeing, from their social media website or whatnot. People are a lot more open to talking about mental health related issues now, so you might have an easier time than my students have had in the past doing this. Another option that you can do is I've also had people do their projects on fictional characters, and I do think that's really cool, especially if the character development was done really well. However, it's somebody with like superpowers, or if it's a cartoon that wouldn't really fit with certain types of diagnoses that we could give, I would stay away from that, just because you wouldn't be able to get enough information in order to do your full project. So I've had people do, Bruce Wayne Batman. I've had people do, what other fictional characters? The Joker, right? So, I mean, I didn't mean for those two to follow that theme, but Girl with a Dragon Tattoo, right? So those are all characters that are really, really well developed, because there are personality traits that are behind those types of fictional characters, right? So those are definitely people that you can do. I've even had, this election had just happened, but I've had people do candidates. I've had people do really anybody that you can find information on. Is fair game. But I already posted that discussion for you to kind of, call dibs, or really call out who you would want to do, just because I don't want to read a paper that two people have done, because in order to stay neutral and unbiased, I need to really make sure that I don't have to compare your paper to another classmate's paper. So that's why write on a different person, right? Make sure you are not choosing the same person another classmate has already chosen. And you can still change the person that you want to do up until, I want to say, probably 2 weeks from now, just because we are getting to really working on this paper, really working on this project. Okay, so let's talk about this prompt. All right, so I already talked about the length, 5 pages of content, and I'll do a breakdown for you as we go, so you can kind of see how much information you should be writing on each topic. So APA format, and let me go and fix this and put APA 7th edition format. Please choose at least 4 sources. Now, you can have 5, 6, 7. It doesn't matter to me how many sources you have, but there needs to be at least 4. Now, 3 of them could be from popular media, and this means YouTube. This means, what is that one show called? TMZ. It could be from People magazine, which I don't really like tabloids because they're not very reliable or valid, but you could possibly use that. However, I would limit that to just one of those types of tabloids. Maybe look at Psychology Today, certain psychology blogs, right? So 3 may be from popular media. I don't really like Wikipedia, but if you must use information from there, then do cite it. And then you should at least have 1 scholarly journal. I would much prefer to see you have 2. And I'll also link a website. I'll put in a hyperlink for the librarian here, Norma. She had made a way for you to look up scholarly journals here available to you at University of La Verne. So it will be easy for you to look at that if you haven't had research methods class yet, or if you haven't had anybody show you how to do these scholarly journal searches. So peer reviewed, make sure that box is checked. That is going to let me know that other experts in the field had looked at this journal and made sure that, oh, okay, this looks like legitimate findings and you can publish this. Now, this scholarly journal is not going to be about your celebrity. It's going to be about the treatment that you are using in order to help treat them. So if you find something like, we've talked a lot about CBT, cognitive behavioral therapy, for anxiety or for depression or for, we haven't talked about bipolar disorder yet, or bipolar disorder, or any other disorders that we are going over in this class, and you want to use that as treatment for your person, then make sure you find a scholarly journal that is peer-reviewed that's about that treatment, that's about CBT. There are plenty of other ones, and I'll talk more about that when I get to that section. Okay, so now moving to here, format of the term paper and presentation. You are going to do a presentation, and I'll put up a separate rubric for that. However, it's not going to be over Zoom. You are going to either add audio to slides or do a screencast-o-matic, whatever you are most comfortable with. And I'll also put up links on how to do that. And all of you are probably way more internet savvy than me, so you're likely going to know more than I do about putting up those kinds of, utilizing that kind of technology. So, all right, so let's look at the format. So, what did I write? Okay, analyzing format. This means you're going to use a clinical perspective, right? You're not telling a fancy story. You're not adding theatrics, right? Save that for your presentation. Anytime you do academic writing or writing in APA style, unfortunately, it's meant to be a little bit more boring, but just because we need to really get the gist of the information that you're giving, and not being swayed or, blinded by fancy words or fancy illustrations. We just need the bread and butter of the information that you're trying to give us. If that is unclear, I'll pull up the sample paper and show you what I mean by that as well. So I'll pull that up after I go through this entire format. Okay, so the first paragraph, so remember you're doing a title page in true APA format, student paper. Student papers do not need running heads. If you do not know what that means, don't worry about it. If you look it up and see a sample paper and it says running head, we no longer use that in the 7th edition. Okay, but everything else, you're going to need a title, you're going to put your name, you're going to put your university, you're going to put my name, and that is going to be your title page. Also, do not forget your page number, just because for student paper, it's important for me to be able to see your pages in order. Sometimes, even online, it can get mixed up, and I just want to make sure that I'm reading your paper in the correct order it's supposed to be in. So, the first paragraph, you're going to talk about demographic information. Use all of the information you learned from the first 3 chapters, right? We talked about assessment, we talked about clinical intake, and here you're actually going to utilize that with the client of your choice, right? With the celebrity, air quotes, of your choice. So you're going to put their name, you're going to put their age, gender, occupation, marital status, etc. That is all demographic information, and that's important, right? Because let's say that you have somebody who presents with symptoms of, moodiness, uncontrollable urges of emotions, right? Outburst, things like that. And if it's in a 67-year-old male, it's going to be different than a 13-year-old female, right? So we're 13-year-old male. That tells us information because people in those age groups, right, of 12, 13, 14, 15, that could be due to puberty, right, which is different than somebody who is 67 years old. Another thing is family history, right? So you're going to want, actually, let me talk about demographic information just a little bit more. This is going to be just half a page, right? It should not be any more than half a page. It's important to know if the person has been at the same job for the last 20 years, or they have not been able to keep a job for longer than a month each time they get a new job, right? That's important information. Marital status, maybe they're in a long-term relationship, and it's been 10 years and they haven't gotten married, or whatever that is, right? Those aren't things that are symptoms. Those are just demographic information. So you can even put in so-and-so was married 4 times and divorced 5 times. So-and-so has never been married, and that's okay. So none of that information is going to be something that we're using as standalone, but it's nice to have because then we could see, okay, what's going on with relationships, what's going on with their ideas of not just commitment to another person, but commitment to the type of therapy that you might come up as treatment for them, right? So this is all important information that we might miss if we don't ask these things. Family history, this is going to be, you actually may find a lot of family history, but choose the information that is going to be the most pertinent to your diagnosis, right? So if so-and-so had, 13 years of trauma and all these things happening, yes, that could play a role, but make sure you're probably going to find information that stands out anyways, just due to that's the way the media is these days. They choose like the most graphic, kind of like appealing, like attractive, sexy things to kind of get your attention. But so that shouldn't be a problem, but I don't want this to be more than like, it's okay if it's like a full page, but I don't want it to be any more than a full page, right? Really, half a page is how much this should be. So here you're going to write about developmental psychosocial history. Likely, if there was something going on in their K through 12 years, you may have heard of that. So-and-so was suspended, so-and-so dropped out of school, so-and-so actually finished high school and or got their GED at the age of 14, and that tells us something too, right? So maybe at a cognitive level, they were ahead of the game and was able to graduate early, but even with kids like that or adolescents like that, the next level, which is college, is kind of a culture shock, and they might not be ready for that next level. So it's important to hear about these things that are abnormal in the sense that the rest of society is not there with them, but it doesn't mean that there's something wrong. It just means that we need to pay attention to what this person that you chose might have been going through during that time in their life, right? So I also want to know about family and relationships. Maybe they don't know too much about their family. This one is kind of tricky based off of who you choose, but again, if you can find family information, this type of information, great. If you can't, skip it and go to the next thing, right? Current living and social support situation. Maybe they are living in a tiny house, which is kind of cool. I think I respect that lifestyle, but it's kind of not normal or not the average that what people would go through. I don't like using the word normal, but that was the first thing that popped into my mind. So this is the type of language that you kind of want to be wary with when you're writing this type of paper. So you want to look at employment history, legal history. So you'll see so-and-so was arrested twice under the age of 18, but after that they never were arrested again, whatnot. You could even talk about medical, surgical, psychiatric history, right? So-and-so had their kidneys taken out or whatnot, right? So you cannot survive without both your kidneys. But if you didn't know, and we haven't really talked about this yet because it's coming on later, but those individuals that actually have kidney failure, they could start to have symptoms of psychosis because kidneys filter out your blood, right? And if they're not doing their job and you have toxins kind of floating around, this could lead to things like seeing things that aren't there or hearing things that aren't there, right? And those are types of symptoms that could easily be misconstrued as something that is like psychosis, right? So these medical, surgical, psychiatric histories are also important. Next here is number 3, description of symptoms, behavioral problems. Okay, this is where I really want you to pay attention to only using symptoms. Do not give a diagnosis here. Don't give a diagnosis here. Do not give a diagnosis here. I'm going to say it one more time. Do not give the diagnosis here. Why? Because if you set yourself on a diagnosis here, you're only going to be looking for symptoms for that diagnosis, right? And you could potentially miss all these other things that are going on or the principal diagnosis, right? So I just want you to, you know, I just want you to write so and so mentioned needing to take 150 pills of whatever a day, right? That's a symptom. Due to this, they lost multiple jobs, uh, whatever it may be. They got a DUI, they got whatever symptoms, right? Behavioral problems. So that's all. I don't want you to write a diagnosis just yet because it could be a whole different diagnosis, right? Maybe it's not a drug dependency. Maybe it's actually, bipolar, right? Maybe it has to do with something else that is going on rather than rather than giving the diagnosis and giving all the symptoms that are describing that diagnosis. I want you to still kind of keep an open mind about what else this could possibly be, right? So that's that section. Okay, assessment tools. So really you need 3. Why do you need 3? Because you need a clinical interview and 2 more assessment tools. So that's 3. So I guess I could rewrite this for you. Where can I write it? Need 3 total. There you go. Okay. Okay, so what this means is you're going to always start off with a clinical interview, right? So that is that whole intake process where you find out the demographic information, the family history, symptoms and behavioral problems, right? However, since you don't have the person in front of you, you're going to be using the media, right? Or maybe a book on an autobiography on them, right? Or a memoir, right? Those are things that you could use too. Just make sure to cite in APA appropriately. Okay, so clinical interview, and then based off of the symptoms and behavioral problems that you saw, you could say, you know what, so-and-so, they kind of had a lot of symptoms of some type of a mood disorder, so what I'm going to give them is the BDI, the Beck Depression Inventory. And the second thing I want to use is the MMPI. Or I want to use Rorschach inkblot test, right? Or I want to use an intelligence test, the SB5. Those are actually for children, and I don't suggest you choose a child as your person, but in rare cases you may. I'd rather you not, right? So yes, okay. So that's your 3, right? And so 6 points to that is going to be 2 points for each. I also want you to use give rationale for each assessment tool, right? So kind of like how I just stated, so-and-so seems to kind of be moody at times, kind of a little bit sad, even more so, they're lethargic, so I want to give them so-and-so test because the BDI is really great for screening for depression, right? So just 2 or 3 sentences about why you chose that assessment tool. Okay, here, diagnosis, number 5. This is the majority of your points, right? That means you need to spend the most of your analysis here and also on the recommendation. So diagnoses, you are likely going to have somebody who has more than 2 diagnoses, right? You've seen throughout the course that comorbidity is huge, whether it's ADHD and OCD or OCD and major depressive disorders, right? So you'll see that you might have somebody who has 2 or 3. If you have somebody, and there are people that may have something like 4 or 5, just pick the main 2, right? Pick the main 2, and then there's different ways you could go about this. You can write about the symptoms and match it to the criteria. So you'll see the criteria. I have them in the slides. Your book briefly talks about some of the criteria, but that's where you're actually going to match up the criteria. You don't need a DSM-5, but the information is very easily accessible online, and also I believe, so it should be online. Okay, so um, you want to have, if you're listing out the criteria, make sure that you have a paragraph really explaining, really integrating the information that you got from 3 over here, descriptions of symptoms and behavioral problems, with the diagnosis, with those criteria. Okay, so that's where, again, how you organize it is up to you, but that's up to you. You just need to have the information. Okay, recommendation treatment plan. So here you're going to, like I said, you're going to find a scholarly journal, because that's what we do in the real world. As a clinician, if we come across somebody who might have, let's choose anxiety disorders, right, or some type of stress-related disorder, other things might not have worked in the past. Traditional, CBT or DBT, which is dialectical behavioral therapy, maybe we want to go and do something else, right? So what I've actually personally heard of others doing, which I don't have any connects, but I've had students and colleagues actually recommend some of their clients to doing equestrian therapy, so equestrian is like related to horses, right? Where they go and they hang out with the horse for an hour or two, they brush the hair. They don't always go riding, but a lot of it is kind of just spending time with horses, right? So you could actually look up information on that and say, I think this would be a great idea for so-and-so, based off of this evidence where you actually found it from a scholarly article that came from a journal that is reputable, right? So that's where you're going to utilize the treatment plan. Now, this is a rough estimate. It doesn't need to be 2 full pages. 1 page, 1.5 pages, okay, based off of how much, what the diagnosis is, right? So I'll just keep this here like that, just so you get an idea of how important these last 2 are. So I left diagnosis open-ended because it's going to depend on how many diagnoses you come up with for your celebrity, right? Here, you may not, you can say something like hospitalization is not something that the client needs right now, and maybe you can say, yes, this person needs to be 5150, and after the 72 hours, I'm going to reevaluate, and maybe this person should stay in a psychiatric or facility or a psychiatric hospital for 2 weeks or for a month, however much you think, with reason, right? So there is no wrong way to do this section as long as you give me a reason, right? I don't care if you say, what I've seen with people with autism is doing dolphin therapy, right? Going and swimming with dolphins. And that's true, right? You could do music therapy, you could do art therapy, there's a lot, laughter therapy, there's a lot of different things that you can find out there, but it has to be something that you've seen works for the diagnosis of the celebrity you chose. Does that make sense? I'm talking to myself anyways, so I hope that makes sense. If not, feel free to email me and I will do more to clarify. All right, let's talk about medications. You're not really going to know how many milligrams unless it is going to be for something like a mood disorder, or if it's going to be something like an anxiolytic, that's an anxiety disorder, right? So that is, you don't even have to do this. I just have this up here just in case you chose a diagnosis where the main medication has to be some type of pharmaceutical drug, right? So if it's something like bipolar disorder, and lithium is one of the main psychopharmaceuticals that is needed to help with that, with the mania, either hypomania or mania, you can actually add that. However, you don't have to. You can say, I don't believe in always over-medicating. You can say some medication is necessary, but for now I'd like to try this first, whatever it may be. right? For therapy, this is where you're going to write about what type of therapy. And again, you can definitely stick to CBT. That's totally fine. You could use just behavioral therapy, psychoanalysis if you're like, if you like psychoanalysis, that's totally up to you. You could say group therapy, right? We could talk about whatever therapy you would like to recommend. Just have the backup for it, right? So techniques you can actually add in. This is just more examples for you in vivo, right? If you're talking about somebody who has some type of phobia, if you have, if you want to talk about dream analysis, EMDR, right? So anything that has an E in front of it is more of a newer type of therapy, not meaning that it's bad, just meaning that it hasn't been around for decades and decades and decades. EMDR actually has been around for a little bit, but that's totally up to you, right? So you could talk about techniques. You could talk about how many times a week. So-and-so, the client should see me or should see a psychologist and a psychiatrist for, twice a week for, I don't know, 2 months, and then we will reevaluate, whatever it may be, right? So that is the recommendation treatment plan. Okay, I say it again, do not go over 5 pages. Again, this is not including title page or your sources, so that is going to be your reference page. Total, you should have about 7-8 pages. It's okay if you give me a 9-page paper, that I'm okay with that, but if I see like 12, 13, 14 pages, you're not writing in a concise APA manner. Remember, if you are going to look at a journal, you would want the information to be very clear. There's no two ways to read it, right? Because you need that information in order to treat your client, right? A lot of people think that scholarly journal articles are really boring because of that. But if you're thinking of, hey, I heard about this treatment and I really want to try it on my client who has anxiety, but it is in Spanish, and your Spanish is like you're in year 3 of Spanish, you want to make sure that journal that you're getting, you're able to read kind of the basics of it and still understand what they're talking about, right? Even if you have somebody translate it for you, or if you have Google Translate or whatever, right? It should be very straightforward, because again, we need that information and we need it fast. Just imagine you are working with somebody that has a general medical condition, right? Like diabetes or dementia, right? If you're looking through a scholarly journal article or APA, you don't want to see terminology that is filled with theatrics and that kind of stuff. You want the gist, because that is really what's going to help you help your client. You might read something like 10, 30, 50 different types of journals, and you want the information, you want to see the results, you want to see the procedure, you want to get all that information in a very straightforward way, right? That is why APA has to be written in a concise way. And if you're going over 9 pages, it means you're not writing in a concise way. If there's a way for you to write 3 sentences in one, write that one sentence, right? Do not be redundant. And this is going to help you with the future academic papers that you're writing. Now, if you're in creative writing or English or other types of classes that are not using APA, that's totally fine. But remember, APA is for research base. So we're talking, if you're in business, you're going to use this. If you are a nursing major, you're going to be using this. If you are in social sciences, any other social sciences, you're going to be using APA, because this is based off of evidence that you need and that you need to understand in a very straightforward way. So here, that's what I mean by not using a lot of theatrics, right? So I already talked about like TMZ. I talked about, I guess like People magazine and stuff. I don't really like tabloids because they're not reliable or valid. But you can use Time magazine, you could use Newsweek, Science News, Science American. You could look up all of this in the ULV library database. And again, I'll link that information for you, so it's going to be easier for you to use, especially if you used it before last semester and you don't quite remember how to use it again. I'll just put up that quick refresher for you. Okay, so writing in APA format, this is worth 6 points. Again, once you actually get used to the APA format, I think you're going to really like it, especially if you're more science-based, because you need information fast. The way to get information fast is to read it in APA style. I know it's boring, believe me, as somebody who likes to kind of joke, and I like to read things that are easy to read, APA was not my favorite, but now if I'm looking for information and I need it quickly, you're going to appreciate it. So these are the basics, but be sure to refer to OWL Purdue website. You just Google OWL Purdue APA style. APA style blog is another one. Let me add that in here. So APA style blog. You can look that up, and it's going to give you a lot of information on how to write in 7th edition APA. You don't need to buy the publication manual. Like I said in the beginning of class, you do not need that. If you do go on, you will need it for research methods if you're a psychology major, nursing, pharmacy, any of those, you'll likely want to use that. And 7th edition just came out very, very recently, so because of that, it's likely going to be around for quite some time. So that is, okay, so always double-spaced typed 12-point font. I don't know if any of your professors have told you this, but when I used to be a hiring manager, a lot of the times when we're looking at resumes, the things that are like Comic Sans, that kind of cute or bubbly font, it gets really hard to read after a while. So for me, I had cataract surgery when I was 25, which is it's kind of like an internal thing where it's supposed to be, if you're 60 and older, you usually get cataracts, but it happened to me when I was 25. And for me, when I'm reading now, if it doesn't have serif, which is kind of the way you can read this and see that there's a line, helps you kind of read along, that means it's sans serif. So sans means none, serif means that kind of line that helps you read, right? So you want to make it easy for the reader to get information really quickly. There were times when I would see resumes, and just because I couldn't read it, the font was a little bit too straining on my eyes, I would just be like, you know what, I can't read this. I would not give that person a good review. I would give it to the next hiring manager and let them see and a lot of the times they would just throw it out. For me, I do like to read the content a little bit more, but if it comes down to it and it hurts my eyes, I can't read it that well. So make sure that you are writing in a font that is going to be very easy to read, easy on the eyes, right? Especially a lot of us are on the computers nearly all day, every day. You know what's going to be easier to read and what's not. Times New Roman is always a good choice. Arial, so Arial is kind of sans serif as well, but it is still pretty easy to read. 12-point font. And I can tell. Believe me, I know every trick in the book to make the font bigger, to make the periods bigger or make the space, whatever. I know all the tricks. You don't need to do that for this paper because you're going to have plenty of information to write for 5 pages of content, right? APA is always left justify. This is left justify, how everything is scooted over to the left. Margins, this is one that for some reason students kind of get mixed up with a lot. I used to too as a student. And for this, margins are 1 inch this way, 1 inch, let me see. This is 1 inch is here to here, right? I just did this to make this start on the next page, but you're not doing that. You're going to go all the way to whatever this 1 inch margin on the bottom is. 1 inch margins on the right, as well as 1 inch on the top. Your header, your paper is going to be numbered up here, right? And it's going to be already set at 1/2 inch. So you already have this set up. Now, if you're using Google, like Google Docs, they kind of are a little bit screwy with their, oh, excuse me, where am I? They're a little bit screwy with their margins. So just kind of like make sure you do like a print view to see if the margins line up that way, so that you don't miss points on that. I am kind of a stickler for margins. If you've had any other, if you've had classmates or friends who have had them before, they'll tell you like I would actually measure with one of those, what are those things called, rulers or measuring sticks, just because I failed so many times not doing the right thing that I don't want you to fail as well. It'll be a deduction of points, but at least you'll learn that you need to do it. Okay, another thing is another thing is with Microsoft Word, if you have, everybody has access to Microsoft Word because of your university account. The margins for Microsoft Word are not always set to 1 inch. So you actually have to go into the layout, margins, and set it yourself. So I know it says like normal is an inch, but just do the print preview and check it out. Okay. Tab the first line of every paragraph, so it should be like this. Sorry, not like this. It should be like this. That's what it's really supposed to look like. And I'm sorry, I didn't do APA format on this, but I will give you these resources that you can look at in APA format. Page number should appear at the top right-hand corner of every page and refer to APA 7th edition publication manual. And really, I had to write this in just so that you get a better picture of what it is that you're writing. The whole point of this paper is to treat this person like they are your actual client. You are in charge of, why is this like this? Whatever. You are in charge of their well-being. In the real world, it's important that we clinicians try to find as many sources of a client's, we no longer use the word patient unless they have a general medical condition, behavior, as they may not be completely truthful or not know how to describe what they're going through. So this is why I want you to get at least 3 media sources in addition to a scholarly journal article. Right? Have you ever tried to talk to even like the closest person to you and you're like, I just can't tell you how I'm feeling because I don't really know how, right? So this is where you are in charge of the well-being. You're needing to get the evidence, but also read kind of between the lines. And just give me backup for how you're reading between the lines. This is there. Why do I have this? Oh, so back in the day when I was in grad school, we actually had to go to the library and find articles printed in journals, but you can have your scholarly journal come from online, which, you know what, I talk like I'm that old. Okay, I had online articles as well, but I also had libraries where I would go and look up information, so through books. So, whoa, why does it say Saddleback? Okay, this is going to be from your ULV library database. When you give a diagnosis, remember that you might find that there's more than one disorder. That's actually very prevalent, so it's not a rare thing, but that's fine. If you don't have enough information, take an educated guess, but really try to prove and explain why you chose that diagnosis. So these are issues that clinicians face all the time, and we really this is not like the best thing to say, but we do look at a client as having all these different pieces to their life that we need to put together, and we need to be creative in ways to figure out how to actually help this person when maybe they've seen 5 other clinicians and those 5 other clinicians either didn't have a good fit for them or came up with treatments that, wasn't really helpful. So again, there's no right or wrong diagnosis as long as you give me evidence for your choices. Same thing goes with treatment. Give me evidence for your choices. Lastly, here's the rubrics, right? So this is the rubric breakdown. I'm going to update this for you because I have the old rubrics, which the paper was out of 100 points, but your paper is out of 50 points for this class. Okay, that was longer than I expected. I'm going to stop this now. Let me know if you have any other questions. Just email me. I will compile all of the emails that I get from all students, and I'll put it up for you in an announcement this week or next week. Okay. Bye.